Hello everybody, it's Dr. Ahmad from London Aesthetics and Regenerative Centre, talking to you guys from our centre here in Harley Street in London. And today we're going to have a chat about body contouring, non-surgical fat loss, targeted fat loss, whichever you want to call it. We're not going to be talking about surgical options. Now, surgical options include liposuction, tummy tuck, gastric banding, gastric ballooning, gastric sleeve. We're not talking about that, okay? We're going to talk about the non-surgical options that are available for people that want targeted fat loss in the specific areas. It really depends upon whether you fit certain criteria as to whether you are suitable or not. And the criteria that we use is something that's known as the BMI, or the body mass index, which is a ratio of your height over weight. Your BMI should be less than 25, which means that it's healthy. A BMI above 25 is overweight. A BMI above 30 is obese. A BMI over 35 is seriously obese. And a BMI over 40 is dangerously obese with a risk to life. Now, when we're selecting candidates for non-surgical fat loss, ideally the BMI should be between 27 and 35. If your BMI is above 35, you're starting to venture into possible surgical treatment options that are more suitable for yourself. The treatment options that are available for you include cryolipolysis, which is freezing of the fat cells. This is where the fat cells are frozen to sub-zero temperatures. The membrane of the fat cells explodes. The fat comes out of the cells. It is absorbed into the lymphatic system, from where it is drained into the venous system and into the kidneys, where it is excreted via the urine. Another treatment available is ultrasound cavitation. Here, ultrasound waves again will shatter the fat membrane of the fat cell. The fat comes out and again absorbed into the lymphatic system and excreted via the urine. However, some of the fat will also go to the liver and is metabolized or excreted by biliary excretion. In addition to that, there's another treatment called injection lipolysis, where we can chemically dissolve the fat. It's like chemical liposuction. Injections are put in at key points, and again, it's done with local anaesthetic, so it's reasonably pain-free, and it causes the fat cell walls to explode and to release the fat. Once the fat has actually, you've broken down the fat cells and you release the fat, the next important thing to think is you need skin tightening. So for skin tightening, there are various options available, which include radiofrequency and HIFU, which is high intensity frequency ultrasound. Once that is done, the fat is gone, the skin is tightened. We can also introduce muscle sculpting or definition, and this is known as HIFEM, high intensity frequency electromuscle treatment. And HIFEM, it's as if you've been to the gym for half an hour. The only difference is you've done 20,000 squats in half an hour as opposed to 1,000. It gives you definition of the body. One of the things that we realised during all these periods was that people not only do they want to lose fat, but they're looking for that six-pack. And the closest you're going to get to a defined body, the fat needs to come in, and then you need to define and tone it, is with the use of HIFEM. So with the combination of treatments for fat loss, skin tightening, muscle definition, providing you are in the appropriate BMI range, can give you a satisfactory result for body contouring. Now, body contouring in itself is a vast subject, and each of the treatments, etc., will be discussed a bit more detail in further videos. We do also recommend that in addition to your body contouring, we will recommend a healthy eating plan for you. And we recommend you to make lifestyle changes, which are very important in order for you to maintain your results as well. It is a holistic approach to looking at not just giving you the results, but educating you to maintain the results. And the program here at London Aesthetics and Regenerative Centre is probably one of the most sophisticated and advanced non-surgical body contouring programs in the world. So please stay tuned for more information on body contouring and what each of the individual treatments do. In addition to this, there will also be further videos in our YouTube channel on generalized weight gain, the pathophysiology of weight gain, and treatments available for trying to lose weight and maintain that, which is a generalized body reduction as opposed to targeted fat reduction. So please do subscribe to the channel, click the like button, and until the next time, thank you very much.